Peter, it's a pleasure to have you here. Thank you so much.
Thank you for having me.
You know, you're with the right audience. You had the Center for Tropical Disease, and it's very interesting for us because we come from India, and every year, you know, there are innumerable cases that could have been cured, you know, with simple steps. And we've been trying to tackle this for decades now. It will be interesting to learn from you how you approach this particular problem.
Well, so one of the things that surprises people when I talk about these neglected tropical diseases, and we abbreviate them NTDs, neglected tropical diseases, is that they actually kill more people than HIV/AIDS does in India. So people don't really appreciate the powerful public health and also economic impact of these diseases, because these diseases not only occur predominantly in the setting of poverty, but they cause poverty because of their ability to affect child development and growth and worker productivity. So these are the most common diseases of the poor in India, and now we've found evidence of these diseases in the United States as well. So among the diseases that we're finding is a big problem is dengue fever,
yes.
Which is now rampaging throughout India. 132 million cases in India of dengue fever right now. So one of the reasons it's getting attention is it's affected a couple of Bollywood stars now as well, including Ravneer Singh and others. Malaria is now widespread. Almost all of the people living in poverty in India are affected by hookworm infection. It's an intestinal parasite that causes blood loss and anemia. And what's so important is not only their health impact, but how India is economically being devastated by these diseases. So, for instance, chronic hookworm infection in childhood reduces future earning by 40%. So, probably because of the intellectual deficits that it causes because of the chronic blood loss. So, can you imagine India is losing 40% of its economy because of hookworm infection? Or India loses over $1 billion a year from lymphatic filariasis, elephantiasis. So I think we've got to kind of change the dynamic and bring greater attention to these diseases. In some cases, the medicines are incredibly cheap. The medicines for lymphatic filariasis are being donated free of charge now by a Japanese company called Eisai. So we've even factored out the cost of the medicines. So it becomes, in some ways, a matter of political will. And the same is true in the United States. We have these diseases among the poor in the U.S., and yet we ignore them.
It's interesting you put a dollar value to the loss through these diseases. But you know, if you look back, India had institutes of research to tackle these very problems for the last so many decades. There are good doctors that come out of India. They do amazingly well in States, in UK, in Australia, wherever they go. Where do you think, when you look at the problem, the endemic problem that we face in India, the problem is that should be better addressed now that, you know, we have all this diaspora who are so well educated, acquainted with the best of technology?
But one of the things that I think is happening is there's a disconnect between the basic research going on in India, and as you point out, there's a lot of excellent universities, a lot of good basic research, and the pharmaceutical manufacturers. The two are not being linked. So what you're not seeing is a lot of new and innovative products coming out of India. You're seeing products coming out of India, derivative products, copycatting processes developed in Europe or the United States being accurately reproduced in India. But we need more innovation coming out of India. There needs to be a better link of what we sometimes call translational research, bridging the outstanding medical universities and institutes and moving that into the pharmaceutical production space.
So the knowledge base has to improve for the right talent pool to come out. You are
now what's interesting is the knowledge base is there, the quality is there, but there's a gap, a valley. In fact, we in the United States we even have a name for this. We call it the Valley of Death. In other words, there's a lot of interesting basic science discoveries being made. There's ability to make products, but the two need to be linked together.
You also mentioned that, you know, it's the way you're trying to put your research is you're trying to educate more the researchers to go into this arena in a very different way. So when you look at India, as you mentioned, the basic foundation is there in terms of education. But how do you think we can improve the research infrastructure?
I think there needs to be a better bridge between the public and the private sector. So most of the educational institutions are basically public institutions, like the Indian Institute of Technology, whereas the pharmaceutical companies are all private sector. So either there needs to be a better bridge, or you need to start thinking about maybe creating some public sector manufacturing options as well. So I think that's certainly going to be an important approach. I think the other is there's not a lot of awareness about these diseases. People don't know about the impact that dengue is having, or hookworm, so there's an enormous amount of advocacy that needs to be done. We need to have scientists and physicians in India be public spokespeople, public spokesmen about the importance of hookworm infection or lymphatic filariasis. We get into this problem that we talk just amongst ourselves, that we don't engage the public in a big way. And this is not unique to India. I've been writing about this problem in the United States. We have a flatline budget for science in this country. And there was a recent survey done by an organization known as Research America. They're a policy advocacy group. And they found that 70% of Americans cannot name a living scientist. A significant number of Americans still believe that Albert Einstein is still active. 60% of Americans cannot name an institution where biomedical research is conducted. And so all of a sudden now we're surprised that Congress is not allocating funds for science. Well, Congress reflects the United States population. So I've turned that inward and say part of the problem is, as scientists, we have to spend the time and be willing to make the effort to engage the public dialogue on science in America. My guess is the same is true probably of India as well. So I've been writing about these diseases in some of the Indian newspapers like the Hindu, and it's quite interesting the responses I get, that people are so surprised to hear about this problem.
Amongst the other funders is Gates Foundation. I want to take the example of vaccine and other pharmaceutical manufacturing. Mm-hmm. Gates and Clinton Foundation and others use India as the opportunity to outsource their manufacturing for medicine. You manufacture here in the US. I'm just wondering why or why not use countries like India?
I think we will start to do some manufacturing in India because they have so much outstanding productivity and outstanding talent. Part of the problem is the model. You see, when you look at low and middle income countries like Brazil or Cuba, there's also a lot of manufacturing capacity, but it's in the public sector. Right. It's either the federal government or the state-owned government. In India, just about all of the manufacturing, to my knowledge, is private sector. Right. So that even though there's great capacity, you still have to have a business model that works. So how do you create a business model for something like a hookworm vaccine, which will only be for the poorest people in India? So there needs to be some innovation there. So the innovation is not only coming in terms of the science, but the innovation has to come in terms of the economics and the social science behind these vaccines.
As I mentioned before, there's enormous contributions on behalf of the Indian diaspora, particularly the IIT alumni. Mm-hmm. Your thoughts on that?
I think there's an incredible opportunity for IIT, for the Indian Institute of Technology, to get involved in this. I believe, especially the commitment now among young people for public service is at an all-time high. If you were to create at one of the IITs an institute for neglected tropical diseases, that will pay for itself 10 times over in terms of new innovations and new products. If there's one thing I'd like to see happen, is an institute of neglected tropical diseases at one of the IITs.
Thank you so much.
Thank you
for the opportunity.
Sure.